Emily Rose Williams. I'm 7 years old, and my favorite thing to do is go on trips.
I'm Haylie Faith Williams, and I'm 4, and my favorite thing to do is riding on the elevators here.
I was born with a heart murmur, and in 1985, children's doctors came up to Casper, and they monitored me there. And when I was 8 years old, I had open heart surgery. And when Emily was born, she had the same heart murmur, and so they started to keep an eye on her. In November of 2006, we saw Dr. Wolf, and he talked to us about how Emily needed to have her ASD, her atrial septum defect, which is a hole in her heart, repaired. My doctor was Dr. Wolf, so he had both of us. At that time, I told him I was 4 months pregnant with Haylie. So they decided that when we were in Denver for Emily's surgery, they would do a fetal echocardiogram on Haylie. At that point is when they found Haylie's heart was having a lot of trouble in utero. The children's cardiologist suggested I go to University Hospital. So when Emily was having her heart surgery at Children's with Tony, I was actually in University Hospital with Haylie. They were trying to slow down her heart by giving me different medications, and the children's cardiologist worked very closely with our doctors at University, keeping Haylie's heart healthy. So while Tony was back in Casper dealing with Emily, just getting done with heart surgery, I was actually down in Denver for about a month. It was kind of scary.
She is somewhat different than her sister. Emily had a straightforward hole. We could close the hole and it's virtually a done deal. Haylie also has a congenital heart defect that was diagnosed pre-birth, and she also had a cardiac rhythm problem. That required treatment in utero.
When we were discharged from university, we went back home, and Dr. Schaefer was able to keep an eye on Haylie at the outreach clinic in Casper. About 3.5 months after she was born, she turned purple all over, and it was a very, very scary situation. And so she had her heart surgery in September of 2007. So we see Dr. Schaefer about every 9 months to a year, kind of when it works with our schedule and when he's going to be in Casper.
There's a valve now which is leaking, the pulmonary valve. In the next 5 to 10 years, she'll need further surgery. There's a lot going on in pediatric cardiology at the basic science level. We're learning about the genetics of heart disease. We are advancing healthcare and treatment and intervention before birth. We just delivered our first baby at Children's Hospital, Colorado, with the expectation of that child needing very advanced cardiac treatment within hours after birth.
I had my surgery at the old hospital, and so did both of my daughters. What hasn't changed is just the way that they treat kids and parents. They take a very scary situation and they make it manageable. Since 1985 until now, in my life, Children's Hospital Colorado has always just been there.
Thank you, Children's Colorado.
Thank you for fixing my broken heart.
I don't know if you can even put into words how much this means to us here, because the doctors and the outreach they have with us in Casper and is just phenomenal, because we wouldn't have two precious little girls if it wasn't for them.
You're the best.